Okay, hello everyone. I'm Mohammed from Griffith University. I work at social marketing at Griffith as a research fellow. So I have background of psychology, public health, and social marketing. So I work in health promotion and disease prevention through behavior change. So based on my background and experience in health sector, so today I'll be talking about what is health promotion, what is disease prevention, what is behavior, and what is behavior, health behavior, and how we can change our health behavior to prevent diseases and to promote health. So I would like to start my talk talking about this universal consensus. There's a set of goals. We call them sustainable development goal. You can see on this screen there are 17 goals that's developed by United Nations and its partner organizations across the world. Just look at the number 3. The number 3, the third goal itself about good health and well-being. But interestingly, the rest of the goals, these are the determinants of health. For example, first one, no poverty. So no poverty is the situation that's giving people financial capability to buy healthy stuff. Food, nourishes food. The second one, zero hunger. This also nourishes body that maintain the good health and well-being. 4, quality education. The education about the health and well-being, and so on. So it signifies how important talking and working on health. That's my favorite things. So before starting talking about health, let's see what is the comprehensive definition of health that's given by our very authentic health organization in the world, World Health Organization, WHO. So WHO says the health is not just the absence of disease. Health is a state of complete physical, mental, social well-being. But for today, for time being, I'm going to focus on only physical health. And to have a physical health and well-being that you have seen in SDG 3, it has two main components. One is health promotion, another is disease prevention. That's also defined by the definition of WHO. So we need to do both. We need to promote health and prevent diseases. Otherwise, we will not have complete health and well-being. Let's see what are the diseases here. So in the world, all diseases are grouped into two. One, communicable, two, non-communicable. So you can see at the left-hand side, these are all communicable diseases, such as COVID-19, Ebola, flu, pneumonia, diarrhea, hepatitis, and others. And this set of communicable diseases has features, the characteristics, natures that differ from non-communicable diseases. The simple feature of communicable disease is communicable. It can be communicated from person to person or animal to person, meaning human to human. It's very contagious, infectious. Now we are passing through this situation, corona situation, pandemic. Ebola happened in West African country. Flu is happening every year, this seasonal. Pneumonia happening every year among children and aged people. Diarrhea happening in many low-income countries almost every day. This hepatitis and such on. So these are the characteristics and natures of these communicable diseases. And understanding this nature, it helps us to understand how to prevent them through behavior change. The right hand side, you can see the non-communicable diseases such as cancer, heart diseases, diabetes, hypertension, stroke, kidney diseases, etc. So these non-communicable diseases has a different characters. So either we can prevent it. If it happened, then there is no cure like communicable diseases. It's only management. So managing non-communicable diseases requires behavior change as well. So what about the disease type? Communicable or non-communicable? Behavior change is key, or behavior is the key. That's why we need to know what is behavior from psychology point of view. Very simply, we can define behavior as a response to stimulus. So stimulus is everywhere, everything is a stimulus around us. So any response we are doing to any stimuli, that's the behavior at very specific level. So when you're talking about health behavior, then you can define response to stimulus that make us healthy or unhealthy. So I can give an example. The thing that if there is an apple on your desk, so apple is a stimulus, then how are you responding it? Are you avoiding it? Or are you washing it and eating it or not? That's the response to the apple, and there's the health behavior. Now think you have apple and a cake on your table. Now two stimulus. How are you responding to this? Are you going to eat apple or are you going to eat cake? So this the situation around us every second, and that determines our behavior. That's why that determines our health as well. So that's why how are we responding to our environment, the stimulus? That's determine whether we are going to be healthy or unhealthy. The evidence-based example you can see on the screen, that's from Australian Institute of Health and Welfare. They have done research in 2019, and they have shown very clearly, you can see the left-hand side, the 5 disease groups: cancer, CVD, respiratory, endocrine, and kidney diseases. And at the top, you can see the picture, 2 behavior here: tobacco use and dietary risk. You see, the tobacco risk is a tobacco use or smoking related to 4 groups of health: cancer, CVD, respiratory disease, and endocrine. So out of 5, 4 diseases are created by smoking. And dietary risk, our response to our food, it contributes to all 5 disease groups. These are not a specific disease, it's a group. There are lots of cancer, different types of CVD, different types of respiratory diseases, diabetics, and other kidney diseases. So this is an evidence-based example from Australia. The 2 of the behaviors are having most of the chronic diseases in our life. So we cannot avoid behavior that contribute either we will be healthy or unhealthy. So that's why the health psychologist or behavior change scientist, they categorize the health behavior into 3. The first one, wellness or healthy behavior. That's meaning it enhances the health or stay healthy. The people who are healthy so that they can maintain their health. The second type of health behavior, the preventive behavior, that help us to prevent or detect our illness. And at the right hand side, these are the example of a specific behavior that either wellness or healthy behavior or preventive behavior, such as hand washing, social distancing, physical activity, healthy eating, condom use. So these are wellness or healthy behavior and preventive behavior. The last set of health behavior is called at-risk behavior that create risk for illness or make us unhealthy. So these are, for example, smoking, alcohol consumption, etc. So when we think about doing health behavior change, so we need to think about a specific health behavior, either wellness, preventive, or at-risk behavior, and we need to develop different types of campaign and communication for that. Now, talking about the behavior change, we understood what is the behavior, different types of health behavior. Now, how can we change the behavior? Health behavior specifically as my interest. So that's a big question to all of us who are working in health behavior change sector. The good news, there are many ways. Different scientists develop different pathway for that. And I categorize them in this way, very easily to understand. First is health on our hands. Mainly this is for preventing infectious diseases or communicable diseases. So hands sanitized or hand washing with soap is the simple and cheap and easiest way to prevent lots of communicable diseases, including COVID-19 we are passing through. This is another research-based information how effective the hand sanitized or hand washing with soap is. For example, this study is done by Nicholson and colleagues in 2014. This table is showing about the effect of hand washing with soap on two types of diseases, the diarrhea and acute respiratory infection. So you can see here, there are two groups. One is hand washing intervention group, the group that got hand washing intervention, another didn't get any intervention. And compared to the control group, all hand washing intervention groups health status, meaning diarrhea and acute respiratory infection was the low compared to the control group. And across the age group, children under 5, children age 6 to 15, and whole family. So this also gives us the importance of washing hand with soap to prevent many diseases. So health on our hand. So do hand washing almost every time. Now, health in our brain. That's the chief executive officer of our behavior. So this is the study, you can see on the screen, how a simple brain training program could help you stay away from alcohol. This study is done by the Monash University in Australia. So Monash University has given us this story. The office goer is walking by a park and he imagining and thinking that he would doing jogging. Then he's walking and walking and walking, and he is walking by a pub. And he saw this environment, the stimulus, the advertisement, promotion. And now he's thinking both walking, jogging, and drinking alcohol. And that's happening in our brain. But he's going to office. So that's why this Monash University is saying the health behavior will be determined by our brain. And that's why they have devised a technique. It's called cognitive bias modification. So this is the training program done by computer to train up the brain to avoid these negative or unhealthy stimulus. The simple task is to do on this screen. So you will see, or participant will see different stimulus, for example, the alcohol bottle, and there will be a button to diminish this from the screen. So this is the way this program is helping or giving training to the brain to avoid negative or unhealthy stimulus. The next is health in our environment, where we are surrounded by. This is a nice picture. I love that one very much. At the left-hand side, 20 years before, we human beings were very slim and smart. but our environment, our TV was obese. In 2010, this turnover, our screen got slim and smart, and we got obesity. Why? So we took care our environment. We invested our time and money on a screen, not on our body, on our health. But that's happened, and it is happening continuously. Now it's time to change again, to go back in 1990. It's taking care of our body, not our screen. This is from Center for Disease Control in United States. So they said in 1920, in United States of America, the meal size was like this: French fry 2.4, burger 3.9, and soda drink 7. What is happening now? So nowadays they're offering the meal that's the larger than that: 6.7 chips, 12 burger, and 42 soda drink. And every time this environment is getting bigger, we are offered with the meal deal and many deals, and we are attracted and influenced by this environment. And these are our environment in Australia: Hungry Jack's, Subway, KFC, Domino's Pizza, Pizza Hut, McDonald's. So we are surrounded by them in everywhere. Every big shopping market, shopping mall, they are present and they are influencing us. You're looking at, our brain is thinking about them, and we are doing this unhealthy behavior eating. So they are very influential. So either we need to control ourselves with our self-efficacy, or government can help us to control their activities. Now, health in our pocket. This meaning when we want to save money instantly, but ultimately we are not saving money. We are spending more at the end in our health expenditure. And that's why every year government is increasing their budget for health. You can see here, $1 you can get a meal. How lucrative this one. So nobody can avoid that. So you can have your lunch with only $1, and a big meal with only $4.95. So lots of things stop. So when people doesn't have that much money, definitely they will try to save money, but they may not know they are going to spend more money in their medicine. This is a study in Australia based on supermarket offers. It says supermarket put junk food on a special twice as often as healthy food, and that's the problem. This research also says 40% Australians buy of the food that's special, and there's offer, there's deal, and these are unhealthy. So this are some examples that we are doing healthy behavior or unhealthy behavior because of our hand, because of our brain, because of our environment. So to tackle them, so we have some paradigm to change our behavior. That's from scientific world. And these are here, how to change. So Jeff Jordan from Rescue, this is a behavior change agency in United States. So he suggested the pathway to change. So we can change our behavior, changing our knowledge, changing our environment that we have seen, and changing our norms. And these are our main approaches to do health behavior change: social marketing, then changing the knowledge, the education, and behavioral economics. But which one is working for you? Social marketing, education, money, or law? So we are very grateful to Rothschild Rothschild has given us a nice matrix you can see on the screen. So it has 8 options, and it is determining and telling you which one will work for you: education, marketing, or law. So let's take a couple of examples here. Think that you are motivated to change your health behavior. So yes, and you have opportunity to change. Just yes. And you have ability to change your behavior. So yes again. Then education is enough to change your behavior. But if your condition is different, so you have motivation to change your behavior, but you don't have opportunity to change it. But you have ability. Then education will not work for you. So you need promotion, marketing. In other scenario, so you don't have motivation to change your behavior, but you have opportunity to do so, and you have ability. You have lack of motivation. So what do you need? You need the law. So that's why law, when we failed to change our own behavior as a human being or citizen. And I'm going to show you a couple of examples from Australia based on COVID-19 situation. You can see on the screen, Victorian Premier Daniel Andrews said, non-compliance comes with an on-the-spot fine of $1,600. And you now know the COVID situation in Australia compared to United States and other countries. In Australia, we are proud that we are much better in terms of pandemic compared to the rest of the world. So we have the law here. Second one is the Premier of New South Wales. She said 6 months in jail, $11,000 fine for leaving home without a reasonable excuse. That's the law, it works. And there is a new law here, public health law, that's passed in recently. Public health COVID-19 restriction on gathering and movement. So when citizens fail to change their behavior, then government step in to help citizens to change their behavior. That's possible when the government is welfare and it has good government. But we, as academics, we have responsibility as well. So it's not that the responsibility of individual citizen or the government. So we have responsibility as a researcher, scientist, or academics, whatever. So our responsibility is working together for behavior change. So any psychologist, health scientist, social marketer, behavioral economist, or social scientist, behavioral scientist has interest in behavior change, we should work together. That's our responsibility. And we should work together for only one thing, that is science of behavior change. Thank you very much.